IgA nephropathy, the silent attack on your kidneys. Your kidneys work every second, cleaning your blood, removing waste, and keeping your body's balance just right. But sometimes your own immune system, meant to protect you, turns against your kidneys. This condition is called IgA nephropathy, also known as Berger's disease. Let's make it easy. Think of your kidneys as water filters. Clean, steady, hardworking. Now imagine someone pouring sticky glue into that filter every day. Slowly the pores clog, the filter still runs but not as smoothly. That sticky substance in real life is an antibody called IgA, Immunoglobulin A. In IgA nephropathy, this antibody builds up inside the kidneys, particularly in tiny filters called glomeruli. Over time, this buildup causes inflammation and scarring, leading to kidney damage. Here's the tricky part. Most people don't feel anything in the early stages, but one day you might notice your urine looks red or cola colored because of blood in it. Sometimes it appears after a sore throat, cold, or infection. Other people may just have frothy urine, a sign of protein leakage or high blood pressure, and some only find out during a routine health check. Who's at risk? IgA nephropathy can affect anyone, but it's more common in young adults between 15 and 40, men more than women, people with a family history of kidney disease, genetics, infections, and even dietary factors may play a role, but science is still exploring the full picture. Diagnosis. Doctors start with simple tests, urine test to check for blood and protein, blood test to measure kidney function, ultrasound to look at the kidney structure, but the final confirmatory test is a kidney biopsy. This shows the IgA deposits that define the disease. Treatment and hope. There's no complete cure yet, but there is control. The goal is to protect kidney function and slow the damage. Doctors use medicines such as blood pressure control drugs, ACE inhibitors or ARBs, steroids or immunosuppressants, a healthy low salt diet, regular exercise, and yes, early diagnosis makes all the difference. The future and positivity, medical science is evolving fast. Newer drugs like SGLT2 inhibitors, targeted immunotherapies, and even gut microbiome based treatments are giving new hope. Your kidneys don't ask for much, just a little care, regular checkups, and respect for what they do every day. Preserve, protect, prevent. Your kidneys deserve it.